For the last several years, Dr. Drew Drummond has been explaining to us how a small bone in the neck can create all kinds of problems for our bodies.
It can. Today we're going inside the Spinal Balance Health Center, where patients dealing with pain are finding relief. A lot of people have neck pain and back pain, and treating it can sometimes be difficult. We've had Dr. Drew Drummond from the Spinal Balance Health Center on our show. Now we are in his clinic. Good to see you, Dr. Drew Drummond.
Hey.
Thanks for having us in here.
No, it's welcome.
Yeah,
nice
love the place here. Yeah. But you know, a lot of people, we've talked about this on the show many times. Why is it so difficult to treat neck pain and back pain?
It's a good question. To get to the reason it's so difficult, you have to know the difference between a primary problem and a secondary symptom. And most of the time, neck and back pain, like a lot of things, are secondary symptoms that are being caused by something completely different. Yeah. So if all you're doing is treating the low back, treating the neck through therapies like, whether it's injections, muscle relaxers, low back therapies, but there's another problem causing it, then the stress keeps feeding into the low back and you never really get to the bottom of it. In the case of low back pain and neck pain, it's usually an underlying posture issue that's being caused by nerve problems. And if you never fix the nerve problems, then you just keep feeding the stress into the low back and it never really gets better.
Dr. Drummond at the Spinal Balance Health Center, one of the things you do is you focus on the nerve problem. How do you treat those nerves?
Well, what we have found is that an upper cervical misalignment is one of the major causes of nerve interference that will affect body-wide systems. So what we have found is that the head and neck should be in an upright position with the atlas being horizontal. And through accidents and injuries, this kind of a misalignment can occur where that bone becomes out of place and it starts interfering with the nerve transmission through the top of the spinal cord.
Sure.
And there's some very important nerves at the top of your neck, some of which control body posture.
So I imagine any interference can create problems.
Yeah, and not just a posture, which I've talked about a lot, but blood pressure, blood flow, any number of things. But as an indicator of whether it's happening, we can look at posture, which is what leads into the back and neck problems. And what we'll find is a normal posture should be upright and balanced with even shoulders, even hips, even legs. And then once the atlas is misaligned at the top of the neck, it interferes with the nerve communication to the back muscles, and one side of the back will be tighter than the other. And since the muscles attach up at the shoulder and down at the hip, it will squeeze one side of the back closer together, then giving a person a short leg that they have to adapt to. And that's where the low back and the neck start adapting. It isn't, the problems don't start in the low back, they in there.
Yeah, and over time, the back adapts to that situation that it's in. And that's where you get the problem.
Yeah, and when people start talking about spinal stenosis and disc thinning and arthritis and all those problems that the low back has, it's really just a long-term stress response caused by an underlying posture imbalance that all starts
right over there
at the top of the neck.
Yeah. One of the things, one of the ways you treat that is through NUCA care.
Yes.
It's a specialized technique. What is NUCA?
NUCA is an upper cervical chiropractic technique that totally dedicates itself to correcting misalignments of the atlas. And what we do when a patient comes in, one of the first things that we do is we do a thorough exam of their posture. The posture will indicate whether or not the atlas is out of place or not, or at least give us some good indicators whether it's possible. And if we see all the indicators with measuring hips and leg length differences that tell us, yeah, that you might have an atlas misalignment, we then do a really thorough X-ray analysis. We'll analyze the atlas from 3 different directions on X-ray, and then with the digital X-ray, we then do an analyzation, and we actually mathematically calculate for each person how that bone is misaligned.
Wow.
And then once we figure out the misalignment, there's a mathematical vector of correction you can come up with each patient that then you just have a very, very gentle NUCA correction that corrects the bone.
When you talk about the NUCA correction, you're talking about the actual treatment.
Yes.
The actual treatment of that underlying issue. What is that adjustment like?
The adjustment's very gentle. It's not a thrusting correction like most people would think when they think of a chiropractic adjustment. There's just a very gentle pressure a person would feel behind the ear. And then once that bone is put back in the right position, the nervous system starts functioning better and the posture will respond near immediately.
And I imagine a lot of people are different, depending on how much they notice relief from a certain type of treatment. What can people expect to experience after that treatment?
It varies from patient to patient. I've had patients that get up from the table and we look at their posture before and after, and immediately it completely straightens up, and even the symptoms just immediately go away. Some people, it will move them toward normal after that first adjustment, significantly enough we can measure it and they can feel it, but then over time they'll start getting better. But one of the amazing things is that the way the nervous system ties in with the spine is that once the structure straightens out, there's other nerves besides just the ones at the top of the neck that improve, and there's all kinds of different organ functions and body systems that start improving.
Yeah, and I think, you know, people, they will try anything to relieve some of this pain. The last option is surgery. You don't want people to get to surgery. Have you been able to prevent people from having to take that extra step?
Yeah, we'll get patients that will come in every stage of the process. Some people are referred in by our current patients that have had success and were their first stop. Others have been to multiple surgeries, multiple medical doctors, multiple physical therapists, even other chiropractic techniques that just didn't address the atlas quite the way it needed to. And we've had, you know, people with multiple surgeries that still have gotten relief. So it's not limited to a certain type of patient. You can always get rid of the underlying problem.
Yeah, so people that maybe have a family member, a friend, and they've tried all these different options, well, if they think they've tried everything, they probably haven't if they haven't talked to you. What's I've met your front desk staff.
Yeah, they're great.
Great crew here. How do they get things started?
It doesn't require any kind of a special referral. Really, it requires me seeing if you have an atlas misalignment that's leading into a posture imbalance, into nerve interference that could be causing your problems. So it's a phone call. You call into the office, our staff answers the phone, and they get you set up with an appointment. The first one's pretty thorough. We spend about an hour with the person, analyzing their posture, getting the x-rays, figuring out if they're in the right place or not. Yeah,
well, I appreciate your time today. Thanks for having us out here.
Thank you very much. It's nice having you.
Yeah. And Dr. Drummond has made it really easy for you to begin investigating back and body pain. The first 15 callers right now will get an exam, an x-ray, all for just $50. To get in touch with his office, call the number listed right there on the screen, 402-452-3400. Well, hanging out on a roof